Hello, everybody. Good morning. My name is Agnieszka Olszewska-Guizzo, and I'm very honored to be part of this exciting session. My presentation today is Neuroscience for Designing Urban Green Spaces, Contemplative Landscapes Exposure for Mental Health. And my background is in landscape architecture and urban ecology, but I've been interested in methods of neuroscience and psychology for many years now, and trying to find a prescription, a rule for designing our urban green spaces in a way that is beneficial for mental health and well-being. And today I present you some of my research findings and background. So as we all know, the urban environmental characteristics are that these spaces are highly transformed and characterized by the eradication of natural ecosystems. This leads to the high level of disconnection from nature in urban population. Also, high level of pollutants of different sorts contribute more or less directly to various physical and mental health diseases. But how the urban environments are designed and the forms and shapes they are taking are also quite interesting when we look at the environmental exposures we all face in the cities. The urban structures are full of dynamic or static, very complex webs of infrastructures and elements and features, textures, forms, and colors that in fact can cause some sort of sensory overstimulation and cognitive and mental fatigue. These kind of characteristics can be a part of the reason why urban populations are even 40% more at risk of developing mental health disorders, such as mood disorders and anxiety disorders. These are the results of the meta-analysis that was conducted over 10 years ago that shows that exactly this populations, urban populations, just because they live in the cities and they are surrounded with this specific kind of environment, are more likely to suffer from mental disorders as compared to their rural counterparts. And since 2010, when the meta-analysis was published, not much improved, and in fact, a lot suggests that it may have gotten much worse. A positive thing is that actually since 80s, the studies and the research on the urban health and the number of publications are growing exponentially, and this area of knowledge is expanding quite rapidly. Still leaving a lot of questions to answer. What it seems, though, is that the solution is in nature. And we can ask why. Why is the nature a solution? But even more interesting for me and from the standpoint of my research is what kind of nature is the solution for the mental health issues in the cities, and what we can do as urban planners, landscape architects, and environmental psychologists joining forces to create more mentally healthy places for urban dwellers. So actually, why the nature is in cities is so good, we kind of know a lot about it thanks to the years of environmental psychology development and various theories, hypotheses that help us find out that natural environments are capable of restoring the attention, reducing stress, they provide improvement in mood, and so on. This is quite clear, and there is a scientific consensus about that. Natural environments versus urban environments, there is a tremendous difference in mental health outcomes. The problem arises when we start looking at what kinds of nature, what qualities of nature, and how we actually can define that nature. It seems like environmental psychologists didn't really delve too deep into qualities and specific aspects that for landscape architects is very obvious that there is a myriad of types and components in the landscape scenery. This may be a reason why a lot of studies, a lot of findings in the nature and health trajectory are so inconsistent. And it really seems that it's not a nature as a whole, but rather certain aspects of the nature, certain characteristics, certain features that make us healthier through the exposure to them, but others do not have that same effect. They can be completely ignored by our perception, by our brain, by our system, or they can even cause some harm. Actually, already in the 18th century, the very famous landscape architect Frederick Law Olmsted, creator, for example, of the Central Park in New York, he was the first one to speak about the natural scenery and specific features, specific types of landscapes that can work as medication. At his times, he wasn't really, his claims weren't very popular because this was the time of battle of styles in architecture. There wasn't any room for such claims yet. Also, his claims weren't supported by scientific evidence. I got interested in the qualities of different environmental exposures at my PhD research stage, and I came up with the contemplative landscape model, which is exactly answer to that lack of knowledge. So contemplative landscape model is composed of 7 key elements that can be scored by an expert on the 1 to 6 Likert scale. It showed a high reliability and validity through validation exercise, and it specifically targets and predicts the patterns of brain activity related to relaxation, stress reduction, mindfulness, and positive affect. There were a range of experiments using the methods of neuroscience and neuropsychophysiology that also showed interesting findings. They were lab-based and outdoors-based. Unfortunately, I don't have time to really get deeper into the details of this experiments, but I can refer you to the publications here and tell you the main takeaways, main findings, which were that, first of all, first and foremost, there was significant difference in the brain response to landscape with high and low contemplative score. So regardless of whether the spaces were both, or they were both green spaces, but they had the different features, different value in the contemplative landscape model, and they caused different brain response. Landscape with high contemplative scores causing mood improvement, and this is a causal relationship. CLM scores were also associated, predicted well alpha and theta brainwave activity and self-reported valence and arousal as well, affective states. We also observed a stronger effect in vulnerable groups, such as, for example, the depressed patients. In the depressed patients, in that group, we observed also the special pattern of brain activity that points at the desirable effects of the treatment of depression, which is quite a promising sign for support of the depression treatment. So what are the main takeaways for the urban space of this sort of research? So first of all, different green spaces induce different psychophysiological responses, and we need to know more about specific features, specific aspects of the places that our brain recognizes, and they can contribute to our mental health. The passive exposure, which is actually quite easy to achieve because it's passive and it's very affordable. You just go there and you just expose yourself with senses to a landscape. So this kind of exposures to contemplative landscape can offset quite well. They can offset the living, the negative effects and the risk of living in the urbanized areas. The generic urban green spaces, so the spaces with low contemplative values that are still green, but they are mainly filling up the space, the green spaces in our cities. They can be considered baseline from where the mood states can improve or decrease as the person moves along their day. And we also, of course, we want them to not get into the negative exposures. And finally, urban spaces are perceived differently by the general healthy population and those people who are vulnerable, so those with mental health issues. And these vulnerable groups can not only benefit more from the therapeutic contemplative exposures, but they can also be harmed more from the urban space, very busy, packed urban space exposure. So this is something to consider for the urban decision makers. So this is all from my side. Thank you very much for your attention. Please ask me a question in the discussion panel or write me an email. I'm also writing a book, Neuroscience for Designing Green Spaces, Contemplative Landscapes, in which the contemplative landscape design will be very detailed, explained. So that's it. Thank you very much and see you in the discussion.